Now see this picture and tell me what is the diagnosis. So can you see here the tumor is having outward growth towards surface. It means it is a type of squamous cell carcinoma. And what is the second clue in the picture? You can see that here there is scar. Can you see? There is presence of scar. So there is a malignancy which is arising from some old scar and which is squamous cell carcinoma. So what is this kind of ulcer? This is Marjolin's ulcer. So what is this? The diagnosis is Marjolin's ulcer. This is frequently asked in exam. And you know that Marjolin's ulcer is a low-grade squamous cell carcinoma. It is low-grade squamous cell carcinoma and it arises from long-standing scar or chronic benign ulcer. So it arises from long-standing scar or chronic benign ulcer. Chronic benign ulcer. Okay, so generally see from which areas or from which scars it is going to develop. So see here, this long-standing scar, generally it is arising from burn scar. So Marjolin's ulcer is arising from burn scar. And chronic benign ulcer, what do you mean by chronic benign ulcer and in which ulcers this malignancy is seen? It is seen in long-standing venous ulcer, if the patient is having chronic post-traumatic ulcer, or if there is radiation-induced ulcer. So from these ulcers, you will find that patient might develop what? Marjolin's ulcer. And if a patient is having chronic discharging osteomyelitic sinus, even chronic discharging osteomyelitic sinus also increase the risk of Marjolin's ulcer. So one basic thing is clear here, that generally it is arising from scar, long-standing scar. And you know that in scar, nerves, vessels, lymphatics are destroyed. So if in the scar, nerves, vessels and lymphatics are destroyed, so what will be the characteristic features of the ulcer? If there are no nerves, it means it will be painless. If there are no vessels, it means it is avascular. And if malignancy is relatively avascular, it means it is slow growing and radio resistant. Why radio resistant? Because we discussed that radiotherapy causes obliterative end arteritis of vessel to manifest its effect. And if malignancy is already avascular, what? It will be radio resistant. Third problem, if there is no lymphatics or lymphatics are destroyed, it means it is not associated with lymph node metastasis. Clear? So it is just based on common sense and it is very easy to remember. See the characteristic features. Since it is arising from scar and in the scar, what? Nerves are damaged. That's why it is painless. It's the painless ulcer. Second, vessels are also destroyed in scar and that's why it is relatively avascular. And if the tumor is avascular, it means it is slow growing. This is slow growing and radio resistant. This is radio resistant. Simple. After that, lymphatics are also destroyed. So since lymphatics are destroyed, it means there is no lymph node metastasis, right? So no lymph node metastasis. These points are clear. Now see how we are going to make the diagnosis. Diagnosis of squamous cell carcinoma, basal cell carcinoma, malignant melanoma, soft tissue sarcoma. In all these cases, how we make the diagnosis? Biopsy. So here also we make the diagnosis by biopsy. We discussed that the tumor or this kind of ulcer is relatively avascular. So and it's a type of squamous cell carcinoma. So we have to go for wide local excision, right? So whenever we go for wide local excision, after excision there will be the defect, development of defect at the site of ulcer. So how you will close the defect? You have to close that defect with the help of flap. Clear? So we have to go for wide local excision with flap cover. Second question, in this tumor or in this malignancy, or in this marginal ulcer, we have to give radiotherapy or not? So we should not give radiotherapy. Why? Because we discussed that what kind of tumor is this? It is radio-resistant. And second, since the site is relatively avascular where flap is used, and if you will use radiotherapy in the flap also, there will be obliterative endarteritis. Clear? So how we make the diagnosis? It is diagnosed by biopsy. And what's the treatment? It's the wide local excision with flap cover. We have to cover the defect with flap. And what should be avoided? Avoid radiotherapy. Radiotherapy should be avoided because this is radio resistant and you don't want obliterative endarteritis in the arteries of flap.